Hello, my name is Dr. Kevin Mercado. This video is to demonstrate how to bandage an open wound that has been created with an impaled object. For the purpose of this demonstration, we're going to use a sterile pressure bandage and sterile gauze pads. Okay, so the pressure bandage we removed from the wrapper already, and we'll remove the sterile gauze pads from their wrappers. And I'll show you how to use the sterile gauze pads for the procedure. So what we're going to do is we're going to use the sterile gauze pads to begin to start to stabilize the knife that's been that's impaled the leg. So what we're going to do is we're going to begin to try to utilize those gauze pads to surround the impaled object where it penetrates the tissue of the leg. And so what we're going to do next is we're going to utilize this pressure bandage to begin to secure the gauze pads around the impaled object, which also will, the pressure bandage will also begin to secure the impaled object. So what we're going to do is we're going to wrap it around initially, like so. We're going to just continue to create figure eights. Figure eights around the impaled object. And what will happen is it'll just continue to create more layers around the impaled object in order to secure the impaled object and allow it to become more stable within the tissue it's embedded in. The purpose of the wrap is to make sure that the impaled object is as stable as possible so that it does not move. We want to secure it, keep it stable so it doesn't damage any arteries or any other tissues any further, so that when we do call 911 and we get them to the hospital, the doctors are able to do what they need to do to repair the leg or repair the tissue effectively. So what we can do is we can then just tuck the end into one of the layers, and then you now have an impaled object that is much more secure within the tissue that it is embedded in. That concludes my video demonstration of how to bandage an open wound that has been created with an impaled object.